Today, we're exploring a topic close to my heart, and that is the indispensable role of diversity, equity, and inclusion in healthcare. With a special focus on language access and community empowerment, we are looking at the heart of healthcare, not just through the lens of medicine, but through the vital perspective of connection and understanding. My guest today is Mauricio Montes de Oca, a remarkable individual with over 2 decades of experience in the healthcare industry. He is not only a certified medical interpreter, but a visionary who has bridged communication gaps, ensuring equitable access to healthcare services for all. Through his work, he has touched lives, eased tensions, and fostered a deeper understanding across diverse cultures, all while advocating tirelessly for fair and inclusive healthcare practices. In today's conversation, we talk about the complexities of care and caregiving informed by his personal experience, the evolving role of medical interpreters, the humane necessity of language access, and the legal frameworks that support it. We explore how healthcare can be more inclusive for non-English speaking minorities. We discuss the impact of language barriers on caregivers, patient safety, and share strategies for advocating diversity in healthcare settings. Huge thank you to Mauricio for teaching us how we can all contribute to a more equitable and empathetic healthcare system. Here is my interview with Mauricio. Mauricio, I'm so glad we finally get to have this conversation. We've had previous conversation, and when I was hearing you share about not only your story, but how you bring so much value to families and people that you encounter all the time around this issue of equitable healthcare, I
Yeah.
wanted you to share that with us today. So thank you. Welcome.
No, thank you so much, Nicole, for having me in your podcast. I am excited to share some of the nuggets of information that I've acquired throughout the years of lived experience and in this particular space. And I am hopeful that it opens some doors for certain conversations that need to happen in many of the areas of healthcare that still need attention. And hopefully, I can be a source and a resource for those who are looking to increase more equitable healthcare as a whole. So, thank you
Yeah.
for having me.
Oh my gosh, absolutely. And your background really has shaped your experience. Tell us about your grandma. Who was she in your life and what was that relationship like? And a little bit more about how did you come into this field that you're working with now?
Oh, my grandmother. My grandmother was a cornerstone for who I am today. I mean, she was very special. She took care of me quite a bit while my mother was a single mother, so oftentimes my grandmother would come in to take that role, and she spoiled me all the time.
Oh,
I recognize that when people talk to me about being a because I'm a single child. I do have a half sister as well, which I consider my full sister. But anyway, my grandmother often took care of me. And it was when I moved to the United States, it was one of the hardest things that I had to leave behind was the my grandmother. So yes, I have a lot of family as well and friends that I left behind. But what really was hard for me was leaving my grandmother behind.
yeah.
And so, yeah, I mean, she was very special for me.
Did she give you that understanding too? I'm sure how it shaped and informed you the complexities with caring for someone that's older. What was that like?
No, thank you for asking this question because I don't actually get a chance to speak about this experience very often. When my grandmother was very sick towards the end of her life, she required a thanatologist, somebody who specializes in end of life care and particularly on alleviating pain. We ended up caring for my grandmother primarily at home. So we had the opportunity to do this in a very different way than I know many people experience in a hospital setting or in a long term living facility. And so I got to experience the dynamics within family as well, which is why I always like to say that we're not a monolith. Each culture is different, but as well as we have a lot of differences within each culture as well for many different factors. And my experience with my grandmother was it helped me understand what it felt like to be a family member experiencing the process of losing somebody so close to me. And it also helped me understand the dynamics and the responsibility that healthcare providers have, not only to my grandmother in this case, but to us as family members, and how complex it is, and how our own personal experiences shape how we think and want to end our life.
Mhm.
And I remember clearly how my grandmother took this and what she said to me when there was towards the end of her life. She had always told me that she was a very independent woman and she loved to be out and about. Actually, my grandmother hardly spent a full day at home till the end of her days. And there was one question that she asked me when she was diagnosed with the condition that she was dealing with, to the point where it incapacitated her to not being able to move on her own. So
Mm.
they had actually set up a intravenous constant pain medication that we could provide to her depending on how she reported the pain. And we were able to alleviate that. But when she was conscious and the drugs were not taking effect into her consciousness, she would ask me specific questions, which were one that I always remember is, son, will I be able to go back out and do things on my own without help from anybody else? And I said, no, not in the current realities of what you're dealing with. No, you can and will go out with us, but you will need help. And she asked, the following question was, will I be able to shower and dress on my own? And I said, no, probably not. And so she told me, you remember what I have always told you, which is when I can't do this independently, there's no need for me to be here any longer.
Mm.
And she used to always say, remember that all those songs that I've already danced, no one can take those away from me, which is a saying that we use in Mexico, lo bailado nadie te lo quita, which means what you've already danced, no one can take that away from you.
Mm.
And that was her saying because she loved music and dancing. So that to me was the moment that I knew that she was ready to go if things didn't improve, and they were not going to based on her situation. So
What a beautiful saying. I'm going to remember that.
thanks.
So beautiful. You have 20 years of healthcare experience. You are a certified medical interpreter. How has the role of medical interpreters evolved over your 20-year healthcare experience? What have you seen in your view? Just have that access to language. It really is not just a legal requirement, but a human right. We were talking about that, to be able to understand and have access to the healthcare that we need.
No, thanks for that question, Nicole. And yeah, I have over 20 years of experience in healthcare. I've been a certified medical interpreter. Actually, I don't recall for how many years, probably 13. And that's because the certification, I don't even remember how many years, to be honest with you, because I don't remember when the certifications first were put into place, because
Right.
that's also a fairly newer in the grand scheme of things.
Mhm.
I also serve as the president of the Upper Midwest Interpreters and Translators Association, where we focus on the development and of interpreters. We provide a network of resources. Our goal is to be able to help interpreters in the aspects of their daily work.
Yeah.
And how has this profession evolved? It's changed dramatically, I would say, for many different reasons. It is definitely multifactorial of how we've landed to what we have today. When I started working as a medical interpreter, all of my work was being done in person, so direct face-to-face contact with patients. As time has gone by, things have now moved into depending on the healthcare system and the state and the different, again, it's multifactorial depending on the resources and so on. There are certain hospitals that only provide remote interpreters. When I say remote interpreters, I mean either via a video setup or an audio setup, where it's either a speakerphone. Some have better systems than others. Um, I do think that this is now a necessity because of the lack of interpreters. The interpreting field has been losing a lot of great interpreters because of the fact that there isn't a lot of recognition for this
Mhm.
profession. It's not understood well enough. I do think that we have a lot of issues with the systematic racism that are in place that also perpetuate this lack of language access. I was just reading a recent article that there was a research done in, it's not super recent, but I think it's like 2016. Yeah, it was 2016. And it was a self-reported study where they conducted this with American Hospital Association conducted this, and it was a self-reported study. And they talked about how nearly a third of the US hospitals do not have a language access program.
Wow.
Or setup, which is pretty high. A lot of hospitals that do offer language access, even though they have these systems in place, there are many reasons of why patients still go without language access, either because providers, there was another study where it talked about, it asked residents and nurses how often they used interpreters in their encounters. And it was very interesting to see that the more years they had, sometimes the fewer instances they would use interpreters for their encounters. One thing that is very prominent that I can tell you I've experienced is providers decide when it's important to use an interpreter, when it's important to them as providers, when the legal ramifications can feel like there is a need for an interpreter. So often translations, which I want to clarify, an interpreter and a translator are also two different things.
Okay, I love that you can explain that. Yes, I didn't know that.
Yeah, thank you. An interpreter communicates with verbal communication, and a translator works with written communication. So there are different kinds of skill sets. There are different certifications. When we talk about healthcare access, there should be a conversation about not only spoken language or American Sign Language or a certified deaf interpreter access, but there should also be talk about translations, because oftentimes patients are provided with certain documentations that they should take home. They should be able to have in the written language. And you mentioned also this, that it is under the Title VI of the Civil Rights Act. And there are many reasons of why we should provide interpreters. I like to think of it from the human perspective. If you were that human, if your grandmother or if your loved one was in a hospice, you would want language access when she wanted to communicate, not only when the providers wanted to communicate and tell her what she needed to do. Yeah, it was very interesting because this research also talked about how half of the encounters that required an interpreter actually get an interpreter.
Wow.
So half of the patients that need an interpreter don't even get one, even when it is already registered that they need.
It's so alarming. And I know even as an English speaking person with an English speaking provider, I have a hard time understanding at times what's being said to me, just in terms of medical language or wanting more clarity around what they're saying, and to not be able to digest that at all or have access to what is happening in my own language. I can't imagine. And it makes me so sad to hear that there is that lack of recognition, which is why I'm hopeful we can shine more of a light on it today, and be able to give the recognition it deserves and highlight, what we need to change. How it stands right now, I guess I'm even unfamiliar with the process of getting a medical interpreter for my loved one or for myself. And then my second follow-up to that is it required? So with that Civil Rights Act, is it a legal requirement to provide that? But is the process that we have to request that? How do we do that? Is there like some general guidelines you can help us with that? And how do we put that in place if we need it?
Those are great questions. So yes, the act prohibits discrimination based on race, color, or national origin. And any entity that receives federal assistance in a healthcare setting in particular, we should be focusing on making sure that they are providing language access. So there are many legal requirements. I don't think it's the right thing to even focus there. I think we should focus again on the humanity. I guess we need to focus on the legal part because that's how a lot of healthcare systems function. They make decisions based on how they're going to be held accountable, either by joint commission or by other institutions that regulate them. But again, I think we need to go back to the human aspect. And so how do you request an interpreter for a loved one? Which is a great question. Interpreters should also not only be available for the patient, but for the family members.
Right.
So if you have a family member who is English speaking and it is in a setting where they are receiving healthcare and you do not speak English, you also have a right to request an interpreter. Now, how do you request this interpreter and how you go about it? It differs from institution to institution. I like to think that it is a shared responsibility. So it's not only the responsibility of the language access department, if there is one. So I guess the first point is, why, if we are trying to provide equitable care, do institutions not have a language access department? So that would be the first question. Right. They should have somebody within their system that it is dedicated to making sure that there is a process for language access, being any spoken language interpreter, American Sign Language interpreter, a CDI, which is a certified deaf interpreter, tactile interpreters, translations. All of that requires someone who understands the process and understands how to make sure that you provide this equal access care. And I just wanted to read a little quote that I recently read, that the president of the Institute for Health Improvement said that there cannot be any progress on providing better healthcare quality without a progress on health equity. So we cannot have any progress on health equity until we address the issues of language access. Right. So that, to me, is essential. There has been plenty of research done. Like I read one of them in 2016. There's another research done in 2020 on ambulatory clinicians. This was like 273,000 clinicians that were asked questions, do you use interpreters? One of the common themes that I see is the use of ad hoc interpreters. Now, I will define the term ad hoc interpreter is any bilingual staff who has no training to be an interpreter, any family member. And on this particular study, I think it was 40, if I remember correctly, it was 46% or something like that, responded that they actually often use ad hoc interpreters. So people that are not qualified as professional interpreters. 40% or so said that they had never encountered an interpreter, that they had never had a encounter with a patient with a professional interpreter. So that's a pretty alarming number, because that means a lot of providers are still unable to or know how to. So going back to your question, the institution is responsible for creating a plan so that you as a provider or the patients or the family members have language access, period. Yeah. So I can't tell you there's one particular way, because it really is going to vary from institutions to institutions. But the first question is, do you have a process for providing language access? And if you do not, the question is, why not? Because if you are trying to provide health equity, how can you, when we have plenty of research that shows that if you cannot communicate with your patient directly, you are not necessarily including the patient in the decision-making process. And if you're using family members, I like to think of family members as filters. And in this case, the better the filter, the worse it is for you, because that filter will decide what should be conveyed to your family members based on their experience and their dynamics at home. Now, for cultures, it is crucial and it's very important that the family is involved, but you also should leave that scenario or that encounter knowing that you either had a conversation with the family member or directly with the patient. So that's a decision that now you can make, versus when you use family members, you have no idea of how much the patient is actually getting, because you don't know what filter was in place at the time of the communication. And so I do think that when we talk about health equity for the elderly, it's important to still provide them with language access. And I think it's also in our community, it's a known fact that we want to, and that we want to make sure that we provide the help they need, especially at this particular times. And it is common that we are the ones making a lot of the decisions. but I also don't think it's right to not provide them with their own voice. I
Right.
think it's I think it's very scary to think that somebody could be at at the end of life, at the end of their life,
Mhm.
without fully understanding where they're at. And we can get into a lot of the discussions of, well, the family knows best. In different cultures, it functions different. So a
Mhm.
lot of the arguments are that family members think they know best what is it that their loved ones need to hear. Um, but I also think we should be able to have a conversation, and we should all, as providers and family members, be on the same page on what really the patient understands. So another thing that it became very common in a lot of institutions is what they call family patient care,
Mhm.
which is the moving away from this healthcare system that we had decades and decades ago, where patients were just told what to do. But I also don't understand how you can claim to be a family centered care hospital, clinic, hospice, living care facility if you do not have a language access department. How do you deal with this?
Right.
How can you claim that you are including the patient when the patient cannot understand what you're saying?
Absolutely. And when we had talked, you were sharing some of the statistics or right numbers around, we have such a growing and for your case, that Hispanic population and just the significant contribution they're making to our economy. How can we better represent and serve this demographic? And I guess, maybe the bigger question is any other diverse demographic is also included in that. What are you seeing in your experience? How can we do that?
Well, I think I love this question because we get to the solutions, which is because I'm all about not complaining
Right.
only, but bringing solutions to the table.
Love that.
I think one of the main solutions that we can bring to the table is to provide opportunities, paid opportunities for people with lived experiences in these communities. People, we have culturally, we place a lot of stock in certifications, credentials, but I'm afraid to tell you that I've worked in very important healthcare systems where people that are extremely well prepared from an educational point of view are still making decisions that baffle me on
Right.
the lack of healthcare access to people who either do not speak English or require American Sign Language or other disabilities. It is baffling to me that we are still operating in a system where we are seeing our patients as customers.
Mhm.
And that's really dangerous because this should not be a system where we are thinking of profitability. Healthcare should be a right, and it should be a equitable right to access
Mhm.
for all. And for many populations, it looks different. And how this healthcare access is provided looks different. And what we need to do is invite those members to the table
Right.
before we create new clinics, before we create new plans, before we there are already things that can be incorporated into Epic systems, into other healthcare process systems that are already in use to make sure that we provide a safety net for detecting patients with disabilities that require certain things. And one of those disabilities can be, for example, I mean, it's not a disability, but one of those things that can be needed could be language access.
Mhm.
So, what we can do is create um, scenarios where we are providing opportunities for members of the community, also those who will be using the services, those who have had family members already experience some of these disparities, bring them into the table. These are very uncomfortable conversations that we need to have, and we
Mhm.
need to be come in with an open mind, with an open mindset, and see how we can change. And in order to do this, you need to be flexible. You need to be able to set them up during non-working hours, and that means investing. That's another big thing. Is you may say that your institution cares a lot about providing equity. Well, if there are no resources allocated for providing language access, you don't mean it,
Right.
because without money, you can't make a difference. And that means also providing additional pay to, for example, if you're going to do a gathering of a community to really absorb some of this information, what you should be doing is setting it up after hours, which means that you're going to have to pay overtime probably to your administrative staff who will be at this event. You need to provide opportunities for childcare. You need to provide opportunities for transportation. How are you going to provide language access within this process? So you really need to invite people to sit at the table and have a say, and also recognize how these voices can be elevated. So not just say, oh, hey, it's important because you are a minority, and I know that you have a lived experience of not being provided the best healthcare possible based on your lack of language access. But what else can I learn from you based on the fact that you come from a different culture, that you have a different background, navigating the healthcare system, understanding, having people that understand how difficult it is. There was what is it on what's the website? There was a website where they created a process that a veteran goes through in order to get to be able to get healthcare. It's on let me look. It's called the Examples of Patient Experience Improvement Veterans Health Administration. And it's through the ahrq.gov. And I recommend anybody to look it up, because it's amazing. When you look at the patient experience journey map, it provides you with the amount of things that a patient has to go through.
Wow.
From before, during, at the appointment, I mean, during the being in the healthcare system, then during the appointment, then after, all of those things that are required to receive healthcare access. And now imagine adding the barrier of language to all of those, and the barrier of not understanding how this healthcare system works.
Right.
So like a very simple thing is, immigrants come in and they don't even understand or insurance process or how to acquire insurance. And you have a lot of these people who are coming in who become contributing members of our society. Most of them pretty much are working immediately, but they're often working in a system or in a setting that is not providing them with healthcare access, nor are they really advising them on how to obtain healthcare. So they don't understand how to even go about getting healthcare, which turns into this situation where patients end up going directly to the emergency department when they need something, because that's the only thing they see as an available way to get healthcare access, especially if they don't have health insurance yet. So those are the things that we need to keep in mind as we move forward, and we either build clinics, and not even that, it's just how do we change the current setup that we have in order to become more equitable.
Oh my goodness. Yes. This is such rich knowledge. I am so appreciative of your insight into this. There's a piece of it too where you and I talked about the medical errors that can lead to death, actually, because of, the crucial piece of effective communication. So, in your experience, what have you seen, right? How have you seen that actually play out where lack of access has led to this, and how do we reduce those instances? And I know you were talking about a program you were involved with, or are maybe involved with at the U of M, right? The Safety Always program. Tell us more about that.
Yeah. So when I used to work for the University of Minnesota for mHealth Fairview, I was involved in a program called the Safety Always. And we looked at all the data on how to reduce harm caused to a patient. And we use a lot of statistics on how to evaluate where we currently were when the program was started at the time, to how and what measurable improvements we can have. And the part that I brought into this program was the importance of language access. So the systems, these are things that are many healthcare, if not all healthcare organizations, are implementing on ways to reduce harm, knowing that the goal, the gold standard is to behave like safety process for a nuclear facility or a safety process for an airline industry, because at the rate that we commit medical errors and at the rate that people end up losing either certain parts of their health or their life because of not following proper medical procedures or recommendations to prevent either infections or falls or so on, it's staggering. The numbers are staggering. I mean, we would be, there's no way we would be okay as a society if that amount of airplanes, and I forgot the exact number. I don't know if it was, I think um, it was a large plane that would be the equivalent of a large plane falling, or a large plane falling of the sky daily, would be the equivalent of how many incidents or deaths we have related to healthcare errors. Now, with lack of language access, healthcare errors become much easier to make, because just to give you examples, I know people like stories. I'm not going to give you a particular story, but I give you examples that are general. You have a patient that has a fistula in one arm and they need to get blood drawn. If you don't have language access and the patient is maybe perhaps not conscious, not fully conscious because it's sedated, and they can't convey this information to the lobotomist or the nurse or whoever is providing this service, you could cause some severe harm to the patient by using the arm that has the fistula. When you have patients who have already had experiences with blood transfusions and they were extremely bad situations, and you're not communicating directly with the patient, how can you really gather this information without having language access? And how do you know then how to deal with it when they need a blood transfusion? If you have a patient who is a Jehovah's Witness, how do you make sure that you make it clear on why the need of a blood transfusion, or if it's needed, or there are other options? Like, how do you, it's all about, can you really have this communication without an interpreter, professional interpreter being there? So you increase the possibilities of a lot of harm by not being able to communicate with patients. You may not be able to get an understanding of somebody going through, perhaps, I'm trying to think of specific examples. Somebody who's dealing with a heart attack, somebody who's dealing with something that is affecting them physically, but it's not easy to physically see. You need communication. You need for somebody to be able to tell you, I'm going through this right now, and you need proper trained medical interpreters so that you can also assess the mental state of a patient. You need to be able to, is this part of language? Is this a language issue, or is this a cognitive issue? Is somebody reducing their are the patient's cognitive abilities being reduced based on the fact that they're going through this particular condition, or is this a lack of understanding because of language? Somebody had a stroke. How do you address without an interpreter? Are their language skills coming back? How do you set a baseline? How do you really address all of these things? And how do you this is a way to reduce harm and a way to reduce errors by just not assuming. I think a lot of the errors that are made is because you assume that somebody else checked. You assume that somebody else already looked at this. You assume that the person who's giving you an order for certain medication is making the right decision. It's all based on assumption. And I am convinced that if you don't have direct communication in the language of the patient, you will be making even more assumptions.
Yeah. What an important point that you just brought up. Because when you think about it too, how can you effectively or appropriately evaluate or receive, I'm just thinking with you had brought up the stroke. How can we provide proper therapy or treatment or evaluation or address cognition if we do not have the
Mhm.
proper communication via interpreter with language? And then if you can't effectively evaluate, you will not have the accurate treatment or plan of care. And so it is this, snowball of misinformation, not adequately treating, not giving people the equity in their healthcare that they need when you really look at how important and how it affects every aspect of that care. I'm so glad you brought that up. Yeah.
And I should mention for those who care about the return on investment, the ROI of this is there's a huge number of research there's a lot of research that has been done to demonstrate the amount of waste on resources in the healthcare system that happen when you don't have language access. And you will have repeated MRIs, repeated CT scans, repeated testing that has already been done because you don't have direct communication with the patient. Also, when you have a system in place still that is not very inclusive,
Mhm.
and you have the history of a lot of communities not trusting the healthcare system for we don't need to go to the Tuskegee experiment necessarily, but many others, and we should go there, the
Mhm.
Tuskegee experiment as well. There is a lot of mistrust. And when you don't have language access, you don't have anybody in the room that actually even understands the complexities of communication based on cultural experiences as well to really help you achieve the main goal, which should be making sure that this patient gets the best possible healthcare.
Wow. Yes. Yes, all of it. And, when you were even talking about including family members in meeting after hours and giving people the opportunity to be present. I had personal experience, we do care conference with families. Well, it's at a set time. It's typically in the middle of the day. People are working. They're not able to be there, so they're not able to even hear the information from the team. And having the understanding of how do we make it accessible to all people that need to have a seat at the table, right? So that they need to be a part of that kind of plan of care.
Yeah. I wanted to follow up on that. You mentioned a care conference.
Mm-hmm.
So to go back to that, because that I have a lot of experience on providing language access as an interpreter
Mm-hmm.
on care conferences. And there is so much going on when you have a care conference. So oftentimes you have multiple providers in the room. You have a lot going on emotionally. I've been in numerous encounters where everybody, including the providers, are able to share how they're feeling about it, which includes even crying
Mm-hmm.
because they feel so strongly connected to the families. And I, as an interpreter, can't cry because if I cry, then communication is stopped.
Mm-hmm.
So we as interpreters have to carry this huge burden on our shoulders that um, that the language access and the service that you're providing at that particular moment is crucial because these are very important moments for the patient and the families. And you have to separate all those emotions and compartmentalize, which is not easy to do. It requires a lot of practice, training, and empathy from the providers also. Empathy towards the interpreter of how do I help them? How do I set them up for success? How do I brief them? How do I make sure that they understand all of the terminology that will be used? Because that's another thing. Being a medical interpreter doesn't mean that you have absolutely every medical term in your head. You just can't. It's impossible.
Right.
Um, so you need to be providers need to be kind to interpreters and help them be successful. At the end of the day, if the interpreter looks good, the providers look good, the entity looks good. So interpreters need to be part of the healthcare team, and that's how it should be. So going back to the initial point is interpreters not being valued,
Right.
uh, and how do we reduce some of this issues that we currently have where more and more interpreters are leaving the field
Mhm.
is number one is proper compensation. And number two is valuing the individual, valuing the profession for what it is. It is a very difficult thing to do. It requires a lot of training. It requires a lot of vocabulary building. It requires a lot of emotional intelligence. It requires knowing how to compartmentalize all of these emotions. We are also speaking in first person. So we use consecutive interpreting as the mode of interpreting for healthcare,
Mm,
and we use first person. So
mm,
I am feeling like I'm dying. I am feel like I'm at the end of my journey. We don't even know truly what that does to an interpreter when you're verbalizing all of those
mm,
things, even
mm.
though they're not ours. They
Yeah,
come through our voices. They go
yeah,
through our minds. It can be very difficult to then get out of that and go to an appointment that is much lighter,
right.
and we end up spending time in a lot of these cases where there is a lot of emotion that we have to deal with and we have to know how to manage.
Right.
And while I understand that this is also the case for healthcare providers, I think there is very little attention being paid to how we support interpreters
Mm,
in the process of making sure that they have the tools they need and that they have the emotional support they need in order to do the work they have to do. And
right.
when we bring in the remote interpreting piece, which I understand that it is a necessity, you remove a lot of the tools that I have available in order to do my job at the best I can, which is nonverbal communication. I can sense a lot of what's happening in a room just by looking at it.
Mm,
I am very intuitive, and I think a lot of interpreters are. We
mhm.
have to be. So a lot of the communication that is being conveyed, a patient telling you with their face that they can't understand, it's almost impossible to do with most of the devices that we currently use. The cameras are usually pointing in a very awkward angle. You don't have proper lighting. You don't have proper mics. So if you have multiple people in the room, that becomes very difficult. It's also easy for the interpreter to emotionally disconnect, which I know I'm counter. It may be like I'm arguing against my previous point of how do we make sure that you can remove that emotion,
Mm,
but you still don't want to be to the point where you're removing the emotion. You want to be able to know how to manage that emotion, not necessarily remove it. And not seeing what is really happening in the room can also remove you from a lot of the suffering that is happening.
yeah.
And perhaps you won't be as tactful as you can be as when you're in the room and you are feeling everything that is happening.
Right, right. Yeah. Oh, as you were talking, I was thinking about when you were saying it affects you emotionally and that when you're saying those words, right? And I read something and I can't remember. It might have been like someone like Brene Brown, right? Where when
Mm-hmm.
we talk to ourselves and we use our brain doesn't know the difference of that if we're saying those words, like we are still taking a lot of that on, right? And just the language that we're using. So that's one piece of it that I was thinking through and how we have to set up those support systems so that you can be successful in supporting our patients and our families. And then there's that when you talk about the human perspective, the feeling of not belonging, how that impacts us, and how in healthcare settings, particularly when you have that diverse background, how do we overcome some of that? And, there's at times that resistance or pushback when we're advocating for diversity in healthcare. Unfortunately, we've seen that. What do you suggest, and how can we make progress towards being effective and making change with that?
I think it's a very important conversation to have. I'm so glad you brought it up because again, it's being inclusive
Mhm.
and being inclusive intentionally, which means that you have to really do a lot of work. You have to do a lot of work in order to make sure that you are willing to change what they're asking you to change. It takes a lot of maturity to be able to recognize that
Mm,
we've made a mistake. We all make mistakes.
mm,
And it takes a lot of work to be able to say, I will do different. I will do things differently. And when we talk about belonging, that is something that's very difficult for patient populations as they go into these healthcare institutions
Mm.
where they're often the only person in the room that speaks the language.
Mm.
Um, so a lot of the small talk that happens within a healthcare facility, like a long-term healthcare facility, if you have access to an interpreter a couple of times a day, which is usually the way it's set up, is requested by when the providers need the interpreter. How are we creating an environment of belonging where these patients can be part of the community that they live in?
Mm.
Um, what systems are in place in order to create an inclusive culture that promotes belonging? Details could, and ideas could be, are you changing your menu so that one day a week there is an option that is different for different ethnicities?
Right.
And I don't mean Americanized versions, like actually bringing somebody in from El Salvador, from Mexico, from Ecuador, from Somalia, somebody who's Hmong, somebody who is from the Karen community,
Mm.
and actually asking them, if you were here, what would be one thing that we could bring in the menu that it's not extremely complex to make, but that we could bring in? Could it be warm tortillas? I can tell you that if I was in a long-term facility, my pet peeve is a cold tortilla. I
Mhm.
hate wraps. Don't bring me a wrap. I don't understand why anybody would want to eat a cold tortilla. That's my pet peeve, personally.
I like it.
Um, so if I'm thinking of myself, I mean, and to me, food it's a very important piece of my
Mm.
life.
Me too. Yeah.
And I would like to have an option where there is more diversity in the food and that you are really being intentional. Now, a lot of people say, oh, that sounds really difficult. Well, it sounds difficult in the way that you currently think of the world. But if you become more inclusive on who you hire, on who you have as your staff, these things can become part of how you behave and how you go about doing business. I
Mhm.
know we talked about not thinking this as a business, but until we change that, that's what it is.
Right.
And yes, those are little details that can make or break how a patient's experience goes. Um, a lot of the elderly in our communities work through their emotions by telling stories.
Mm.
And it's really difficult to be sharing a story with somebody who has no context of your culture or who's not, because somebody can help you provide you context with the culture, but you have to be willing to listen. So to create belonging, you have to create opportunities where you're not just coming in the room and reading a checklist, but
Mm.
you're actually asking, like, don't just ask, hey, how are you today? Do you have any pain? Is there anything that I can do for you? Usually the answers are pretty short. No, I'm okay. It's fine. Versus something like what you're doing right now. Tell me about, how was Somalia when you were little?
Mm.
How is Mogadishu? How is Mexico City? How is it living in a different culture? Um, what has your experience been on being in a different country, not speaking your language? I remember my going back to my grandmother. I had her visit me many years ago before she passed away, and she couldn't understand anything that was going on around her. Transportation was a big issue. She depended on us to move anywhere. Minnesota, if you don't have a car.
Mhm.
Um,
It's so true. Hard to get around. We're both in Minnesota, so
yeah,
it
it's
is.
so
Yeah.
hard to get around.
Yeah, it is.
And this also plays a huge part on how people receive healthcare or
Mhm.
not receive healthcare, or when they receive healthcare, when they have transportation available.
Yeah.
And going back to my grandmother, she came and visited me, and she loved watching Mexican soap operas, which are actually pretty popular around the world. They're some of the most translated soap operas.
Mhm. Is that the novella? Is that what
Those are
the
the
yeah,
telenovelas,
yeah,
which
telenovela.
is funny. But my mom, when I moved to this country, I did not speak English, and my mom was my interpreter.
Mhm.
And her her experience on being an interpreter started when she was pregnant with me. She actually used to work because my mother's trilingual. She speaks Portuguese,
Mm,
um, Spanish, and English, and she used to translate soap operas and other content into Spanish or English, or from Portuguese, or from Spanish to Portuguese, and so on. And that's how her journey as an interpreter started. That's actually how I started. Is my mother was an interpreter, and she got me into it because she saw that there was such a huge need, and she said you should give it a shot because there are a lot of people that really need these services.
right.
And so going back to my grandmother, she would tell me it was lovely to see you, and I really love spending time with you guys, but I had to watch the reruns of the soap operas that I've already watched, so that wasn't fun. And there wasn't a lot of things for me to do when I don't speak the language. So it brings me back to belonging. She felt clearly, even though we created the most welcoming environment,
Mm,
everything we did didn't make her feel like she belonged. And that's because we can only create a microcosm inside her home. When she left the house, everything was so foreign to her.
right.
And luckily for her, she didn't have to be here. She was had the opportunity to either visit or not. From that point on, we always visited her. She never wanted to actually return because she was just didn't feel like she belonged.
And the cold. No, I'm kidding.
Yeah. I
And the
mean, yeah,
cold.
the cold, which is not,
Um,
which is very unforgiving to our elderly
right.
as
Yeah.
well. You know, it's
And when
forgiven
you
to,
have lack of transportation, or if you're waiting for a bus, all of it, it just makes it so much, right? The barriers. There's so many barriers. Yeah.
yeah. And I have a lot of patients. I've had a lot of patients who have told me I didn't make it to an appointment because it was so cold and I have to walk
Mm,
so many miles or so many blocks in order to get to a bus stop. And then how long I have to wait at this bus stop out in
yeah.
the cold, sometimes in even dangerous neighborhoods.
Right.
So it's very difficult. We don't really have a good setup in Minnesota in particular. And I know other states have something similar
Mm,
to really provide equitable access to transportation, which leads into more equitable care.
right.
So that's
Right.
another big piece is how do we have to be very intentional. And going back to the point is how do I become intentional is by also paying the people who have the expertise for the time that they are providing, because all healthcare administrators, all healthcare providers are being paid for their time. So when you invite individuals to help you understand how to better care for the communities that they belong to, you also need to compensate them. It is also a form of racism and discrimination to not compensate people who have information for your systems to change, because at the end of the day, again, it's still a business. So in a way, it's like you're hiring consultants for free.
Mm-hmm. Completely.
And
Yeah.
public speaking gigs and engagements on how to reduce healthcare disparities are often something where people are asking you or asking me or others like myself to do for free, where I find it very unfair because we also need to provide for our families. This is a job. And while I am very passionate, I already do a lot of my volunteer work. I
Mhm.
am a president of a nonprofit organization for the called UMSHA, like I mentioned earlier, Upper Midwest Interpreters and Translators Association. So I already do my work on my volunteering time, and that's some of the volunteering. I do other volunteering. Um, it is not it is not something that I need help with on by from somebody else to set me up for additional volunteering work.
Right, right. Oh my goodness, that's so true. And I think I've experienced that too, even in a more like altruistic field, or like the care world, where there is that expectation of, oh, out of goodwill, will you do all these things? And I hear that, and a lot of it we do, right? But we only have so much capacity, because at the end of the day, we want to be able to be supported financially to grow the work that we're doing,
Mhm.
and to be able to, I look at it as that investment, right?
Mhm.
You have to be able to invest in things that are important so that that mission can only grow and reach more people and be more
Mhm.
successful. So I'm glad you
Like,
brought that up. So you had referenced, growing up in Mexico and then being able to move here, and there's caregiving. And I know that that was a part of a life for your family and just the different cultural differences and language barrier compounds the challenges we already face as being a caregiver. And how do you see, like, how can we support caregivers that are dealing with just these different compounded challenges? And I know that um, having that diverse background is a piece of just even more, we have to walk through some of those barriers.
yeah, I think one big point that I always emphasize is be intentional on hiring for diversity. One common thing that I hear is, well, oh, we're all competing for the same few minority individuals in the community that can provide these services, which I don't buy that because oftentimes I hear this coming from different industries, and I don't understand how a tech industry can be competing for the same talent that a healthcare industry. And what are we doing as institutions, as either government institutions or healthcare institutions or educational institutions, to provide the resources to the communities, to these communities of color, to these minority communities, to grow into the spaces that we need future specialists or practitioners in? Are we investing in this community to make sure that we set them up for success? So one way to be intentional in an institution is, if you have a position for a certain, if you have a certain position that is open, don't move forward until the hiring process, until at least 50% of your applicants are diverse people. And
Mm,
diversity looks, I mean, diversity is, it's a big thing. It's not just different colors, it's of different skin colors. It's differences from gender identity, from um, neurodiversity. There
mm,
are many differences within all groups of people,
mhm.
but you have to be very intentional. If you are setting your goals for your organization to become more diverse, what does that mean? How many people out of the hiring, out of the number of people that you will be hiring, how many of those will be people of color? And if you're not meeting those quotas, then why are you unable to reach to these populations? Are you using only, for example, Indeed, or are you only using certain tools to recruit your candidates? Does that mean that you're not even being exposed to many of these communities? Again, in order for you to know this, you need to invite people like myself and others in the Somali community, in the Hmong community, in the Karen community, to sit at the table and say, we are, our goal is to be very intentional on hiring people who are, who look like the communities that we serve.
Mhm.
So it is a huge incentive for the institutions also, because the more diverse the population is, the more diversity of ideas, the more creative they are. Research shows this. It doesn't hinder you, it actually enhances your team. It
Mhm.
helps you, it helps you with those blind spots. We all have blind spots. We all have our own biases. And you have to be very cognizant and very open about not wanting to behave based on those biases. So
Right.
you have to have a system in place for hiring. You have to have a system in place for being inclusive
Mhm.
with those minority communities that you already have in your system. So if they are only fulfilling the most low rank roles in your institution, you need to ask yourself why. If you really want to make a change, is why are in minority communities in my institution have roles at higher levels?
Yeah.
And how am I making sure that I include these voices in order to really make a change and be intentional? So
Yeah.
those are, does that answer your question? Does
It
that?
does. No, that's super helpful. And even as you were sharing, I was thinking through the burnout that can be incurred by just all of the various other hurdles we have to go through and cross through that. What's your thought around burnout within that caregiver dynamic and with the just the challenges of trying to get our voices heard within that?
Oh, that's a great question, and it's interesting that you bring up burnout.
Mm,
And burnout is a huge topic,
mhm.
and it happens everywhere. And burnout for caregivers can only get worse when you have no way to fully communicate. You already have a lot of burdens as a caregiver
Provider.
because you often, I mean, you have your family that you're still dealing with, you have your work that you're still dealing with. And on top of that, now you are providing care for somebody who's sick. And if you don't have any background in healthcare, this is also extremely stressful.
Mm,
Additionally, to the already stressful situation of having a family member who is sick. All of that stress compounds when you cannot access things in your language, when you don't know who to reach in order to get some of these questions answered in a comfortable manner. And I mean, a comfortable manner is with somebody who understands you.
right.
So you're navigating a system that you don't understand, you're navigating resources in a language you don't understand. You actually, most of the time, don't even understand what are some of those resources that are available.
Mm,
And so, again, if the institutions don't have anything in place to help these caregivers be as successful as they can be in this particular roles, if we think of them as roles, because they really are,
yeah.
if we're not providing them with the tools to be successful, they're going to fail. And that's the failing in this particular topic means burnout.
Right.
And how are they then going to continue being members of our community when they're getting burnt out by trying to care for their elders?
Mhm.
And it's a huge economical burden, it's a huge emotional burden. And again, we go back to belonging. If you don't have a community that you feel like you belong to, is really hard to ask for help. If you live in communities that don't necessarily have as one of their primary things to help each other as neighbors, to
Mm,
really care for each other. Um, like in Somalia, I've heard many of my friends have said it takes a village to raise a child.
mm,
And when they tell me stories of how they were raised, it's not a figure of speech. My friends from Kenya have told me this. It's literally how they used to raise their children. Everybody in the community played a role.
mhm.
Um, and when you move into communities that are very isolated or isolated, I should say, maybe they're very to their to themselves. They're not really creating a community. And now you have the burden of caring for a person who in your family who's sick, and you don't have the resources financially and education and all of it,
Mhm.
and you have no one to turn to in your community. That makes it so much more difficult to deal with.
Yeah.
So yes, we have very high numbers of burnout, which then in turn uh, usually means that loss of jobs, loss of income, um, and you now have potentially a depressed individual who now needs other medical resources in order to go through this, which perhaps should have been in place ahead of time. Are you providing with psychological support, therapists,
Right.
counselors, to be able to help this caregiver go through the difficult process of
Mhm.
something that can be a very lengthy process as well? Because oftentimes people think, oh, you do the caregiving role uh, only for a little bit, but it sometimes can be a very lengthy process.
You're
And
right.
then you sometimes have the what do you call it? The sandwich generation, which
Mhm.
you're caring for children, young children, as well as elderly parents.
Mhm.
That puts a lot of stress on an individual. And if you don't speak English, or if you are deaf, um, or you have other disabilities, and the institutions you are that you have access to are not providing you with those services and have no plan in place to help you, you're at a huge disadvantage.
Absolutely. Now, when we were talking about like the greater reach, there is so many people that have a lot of, I don't know if buying power is the right word, but it's
Mm,
influential when you look at the numbers.
mhm,
Tell us a little bit more about that. It's important that we talk about this regardless. It is a
mhm.
human right issue. And there is also this understanding that we do need to reach this large demographic because there's influence and they're, collectively we want to hear their voices. And so you and I talked a little bit about that. I'd love for you to elaborate on that a little bit more as we wrap up our time, and just how are you encouraged and what can we do to make sure that, yeah, this all comes together and that we can, as that collective raise that equitable healthcare together.
No, I'm glad you brought that up. Yeah, it was I cited there was a UCLA research study that was published last year that talked about how in 2021 Latinos contributed 39% of the growth of the US real GDP
Mm,
during some pretty pivotal years, I would say as well. Um, the numbers were staggering because it talked about how Latinos in the US, if they were an independent country, would have been the fifth largest economy in the world,
mm,
above the UK, above India, which are
wow,
some pretty strong economies globally, globally speaking.
yeah,
So, why I brought that up is because it's the business imperative for everyone to think about not only are we wasting this great resources that could be gained, or maybe wasting is not the right word. We're not tapping into this great resources that we have available in our communities in order to be successful at whatever it is that we're trying to achieve.
mm,
Um, if, and I know many do, still
mhm,
think of healthcare as a business, if that's what's going to move you, then think of the buying power. That's
right.
a lot of people with a lot of money that can be either choosing your institution or
Mm,
another institution to
mm,
either bring their family member to
right.
or to get care of themselves.
Yeah.
So I think it's important to just put that in perspective, because it also speaks to this argument that I often hear where, oh, this population drains the system, this population takes away from the system. I
Mm,
believe that that's a very it's an uninformed opinion, because I think numbers don't lie. And if 39% of the GDP in 2021 was brought in by Latinos in the United States, or Latinx in the United States, I think that's a staggering number. That's close. I mean, that's pretty close to half.
right.
And just to conclude, I guess what I would like to leave everybody with is the idea that we can make things better if we are intentional. We can make things better by including those who belong to these communities in order to make a difference. We can we can change things if we are willing to sit with the discomfort of what it means to change.
Mm,
We can and we will be part of the change when we are committed to making a difference in the life of others, and when we look at each other just as human beings. And I know it's hard sometimes, and I know that we live in a world that is very divisive. I like to always think of how can we find common ground.
mhm,
How can I identify with you? How can you identify with me? Because at the end of the day, we're all seeking the pursuit of happiness. We are all trying to achieve pretty much very similar goals. They differ in how we go about them, but most of us I would say that are seeking to have a safe environment to live in, have a community that you feel like you belong to,
mm,
have health, and have the best possible outcomes for you and your loved ones. And what makes us different is there are very few things that are very superficial and that are the color of our skin, the language that we speak,
mm,
the religion that we follow, or the faiths that we have. At the end of the day, if you dive deep into most of these beliefs, there are many commonalities. There are more common thing. There are more things that are in line with each other than our differences, and that is to love each other, to respect each other, to help each other. And I am never going to give up on this fight. I do think that it's worth fighting. I will dedicate however much time I have on this earth to make sure that I help others who are in situations that are not as privileged as mine. And I don't like to focus on what I don't have. I focus on what I have, and what I do have is I have a voice, and I want to make sure that I provide a voice to those who are not being heard. And I want to make sure that I am always thinking about the most vulnerable. Mm-hmm. And I want everybody to be kind, that we are dealing with other human beings. And then in a different story, that could be you, that could be your child, that could be your mother, that could be your father. And you should treat not only people how you want to be treated, but you should treat people how they want to be treated. Mm-hmm. And when we are intentional about really creating systems of equity, we will achieve those. But we have to all be intentional.
Thank you. That was so beautifully said. And I'm so glad you're on this fight and that you're not giving up. Having you share, I cannot wait to get this out into the world. It is such a mission that's important, that I believe in, that I know you are making a difference in what you're doing. So thank you. Thank you so much.
Thank you so much, Nicole. I really appreciate you providing me with an opportunity to talk to you. I look forward to continuing conversations with you, because you're amazing at the work you do. And I really admire how much you care about others as well, and those who are more vulnerable. And I thank you for the work you do. So I appreciate it. And whenever there is something that I can do to help you, or there is a opportunity for me to help you, please reach out, and I will not hesitate to be there for you as well. So thank you.
Thank you. Likewise. Me too. I'm here for you. We've got this.
Thank you.
Yeah.
We got this.
Thank
you.
Thank you. Are you looking for more support and community? We sure are. That is why I'm so happy to highlight one of my favorite podcasts in the caregiving community, Confessions of a Reluctant Caregiver, hosted by my friends and sisters, Natalie Elliott Handy and JJ Elliott Hill. They offer a unique blend of personal storytelling, expert advice, and candid conversations that shed light on the real-life challenges and triumphs that caregivers face. Tune in to Confessions of a Reluctant Caregiver wherever you enjoy your podcasts, or explore more on their website at www.confessionsofareluctantcaregiver.com. Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.